John Coombs here from Global Health, and I'm back with Dr. Daryl Turner, World Authority on the Thyroid Gland and Endocrinology. And we're going to follow on our earlier discussions and discuss the issue of reproductive cancers and the use of programs and protocols that will significantly reduce the risks of reproductive cancers. Daryl, would you like to elucidate for the audience just some of the programs that will help with this, please?
Yes. So just before we were talking about iodine and the important role that it plays in reducing your risk of getting cancer. So let's just talk about women, because this mainly focuses on women. This focuses on hormone-driven cancers only. That is breast cancer, uterine cancer, ovarian cancer, prostate cancer, and thyroid cancer, and all the precursors to those. In other words, for women, it is breast lumps, dense breast, fibrocystic breast disease, and hot nodules, as is with uterine fibroids, ovarian cysts, and lumps on your thyroid, and of course for men, enlargement of the prostate. So these are actually caused by lack of iodine. And these cancers do not happen. I mean, cancer doesn't happen overnight. It's an opportunist. Each of us have about 2,200 cancer cells in our body right now, even though we are perfectly healthy. And these cancer cells are looking for an opportunity. In other words, they're looking for an opportunity to multiply. If we don't have enough iodide in our systems, we give them the opportunity. The breasts are one of the major concentrators of as is the prostate for men, of iodide. It needs more iodide than any other part of the body. And hence the enormous increase in the amount of breast cancer patients worldwide. Breast cancer takes about 13 years to grow. In other words, from the time the opportunist cancer cell is usually in situ, that means it's usually in the ducts, starts to multiply until you can really feel it or knows the problem is about 13 years. So this is a slow process. And if your body is starved of iodide, which most New Zealanders are, I think is about over 90% of New Zealanders are starved of iodine, then you start to get all the typical precursors to breast cancer. And I just want to run over that list again. It is fibrocystic breast disease, dense breast lumps, and little hot nodes or little hot areas around the breast. And with iodine, it is very simple for us to reverse those if we know that they are there. The maintenance dose that we give out for just straight maintenance of the body is 12.5 milligrams. But if you have one of these problems, including the enlargement of the prostate for men, or uterine fibroids, or ovarian cysts, we increase that dose to 50 milligrams per day for a short period of time under very controlled conditions by your GP or the doctors who have to put you onto this program. And there's a high likelihood, in fact 98% likelihood, that we can reverse those lumps and bumps and denseness and fibroids. That also goes for early stage cancer only, where we can attempt to reverse the cancer cells with high doses of iodine.
So we talked earlier on that there are tests available, which is the Thyroidine and the Thyroflex test. So that will let us know both whether the thyroid is helping to regulate the various hormones in the endocrine system that are in the breasts or the reproductive regions. and will let us know whether we've got either thyroid functioning well and iodine iodide in correct balance. So we've got the tests to actually measure this.
Yes. We have very definitive tests. We use iodine tests for with urine or saliva, and it tells us how many parts per million your body is actually using and retaining.
And we talked earlier on about the thyroid gland being a master gland, didn't we, and helping to regulate some of the other glands, including these reproductive glands.
Yes.
So there are reasonably simple solutions once we know what to look for.
Yes. I'd like to tell you a little bit about a very good associate of mine. Her name is Lynn. She's actually a doctor from the USA, and she actually writes about iodine being, as she calls it, in her own words, iodine has become a major public health crisis. I mean, why have the amounts of breast cancer and prostate cancer risen so high? In fact, prostate cancer now outnumbers breast cancer in the entire world. Why have we seen this enormous surge of these breast cancer and prostate cancer problems? And in her book that she wrote on cancer and iodine, and she is a breast cancer survivor herself. In other words, she, being a doctor, went to all of her and all of her associates, the best doctors in the world, to treat her breast cancer. She was shocked that she had breast cancer because she had been dealing with breast cancer her entire life. That was her career. So when patients used to come and ask her, why me? Why do I have breast cancer? She used to say, well, I don't know. Well, and she does know. She's written a whole book about the critical role that iodine played in reversing her early stage breast cancer. And this is out of her book. So I'm virtually just going to quote this out of the book. So you got cancer, you're under shock, and you panic. She panicked. In other words, she thought that she had to get it out of her body straight away. Well, as I said before, just a few minutes ago, it's been growing there for 13 years. So the decision that you make today, or 1 month's time, or 3 months' time, is not going to make any difference to the cancer that they have already discovered that's growing in your breasts. Right?
This is at stage 1 level.
Stage 1 level, yes. And then the doctors, the specialists, are required to follow a standard of care, and we all have, unfortunately, we all have internet now, and of course, if we find we have a major disease, what do? We wiki it, or we do research, and quite often we know as much as the doctor, as a GP knows about the subject when we go and see him. Unfortunately, and I'm a doctor myself, it's called questioning behavior. That's what we call it. I mean, when a patient comes and starts to question us, well, we are the experts, I mean, you don't start questioning us. We tell you what to do. And, of course, the next thing she says is fear. Fear makes you jump into the first available treatment. But is that treatment, the chemo, the brutality of having your breast removed, the right course of action? Does radiation treatment help? And she says, and she's a radiologist herself, she says radioactive isotopes or radiotherapy treatment do not increase your overall chances of survival whatsoever. That's a fairly bold statement for someone who's been in the field for her entire life. And she says, and she went on to say that, unfortunately, a lot of the medical community, they make their decisions on a thing called consensus-based medicine. In other words, is not on evidence-based. So you need to make decisions if you're facing the precancerous conditions, or if you have early stage cancer, you need evidence-based a decision path based on evidence-based medicine. That is, what is researched and what do the researchers say you should try first.
And would you like to quote the name of that book there, Daryl, just in case people are interested?
It's called, is Dr. Lynn Farrow, Farrow. It's called, the name of the book is called The Iodine Crisis.
Thank you. So we've been talking about the thyroid gland, we've been talking about iodine, we've been talking about the opportunity to mitigate. Are you saying to totally mitigate against reproductive cancers with preventative type systems?
Yes. Let's just talk about uterine fibroids. The reason why you get uterine fibroids, and I know they're fairly common, is that without iodine, the lining of the uterus is not able to shed properly every time you get your menstrual cycle. In other words, there's always a few cells, and these cells build up, and this is what causes the bumps and the lumps and the fibroids within the uterus. If we give you a high dose of iodine, the lining is able to shed properly as it's supposed to. So it's lack of iodine that causes the shedding, and that's just on one problem, uterine fibroids, which can lead to uterine cancer.
So this is preventing a lot of things like radiotherapy, surgery, and some of the other heavy chemical systems that are used.
Yes, correct.
And it's very inexpensive, these programs?
Iodine is very inexpensive. You've got to be under someone who's skilled in the techniques on how to get you onto the high doses of iodine. But it was pre-cancer. The lumps and bumps is fairly straightforward. With cancer, with early stage cancer, it's a little bit more complex. It involves other mechanisms within the body, such as cutting out the sugar in your diet and a few other things. And it's a little bit more complex than just saying, we'll just give you iodine only.
Yeah.
So there's a whole program with 8 different points that you have to cover, including the amount of sugar that you intake.
This is once cancer's reached a certain stage.
Early stage cancer, yes.
Yeah, early stage.
Yeah. In other words, you should try this before you try anything else.
Right. So in summary, there's tests available to test your levels of iodine and iodine. There are tests with the Thyroflex to test the operational capacities of your thyroid gland. And the thyroid gland is the master gland that helps to control or regulate most of the reproductive glands.
Yes,
as well as work in harmony with the adrenal system.
Yes,
for the vitality and immunity functionings of the body.
Yes, you got it fairly well summarised there, John.
So these are fairly important basic processes towards good health.
Yes, correct.
Simple to diagnose, simple to treat.
Yes.
Daryl, it's been very, very helpful. I'm sure a lot of our audience will be really interested in this because this is such an emotive topic, and obviously prevention is better than having to try and cure something once it's reached a certain stage. Thank you very much. When we come back after the break, we'll be discussing issues around IQ, iodine and IQ, and cognitive abilities and capacities. Thank you, Daryl.
Thank you, John.